Hello, I'm Tony DeMaria, the editor of JACC, and I'm here with another edition of the Genuine article. And again, I have the pleasure of talking to one of our associate editors, Greg Feld, who's the director of the electrophysiology program at UCSD. And we're here talking about our February 26th issue of JACC. That's a focus issue developed to atrial fibrillation, a problem of increasing importance in our aging population. And so one of the very interesting articles we have addresses a topic that's been batted around for a while, which is the role of statins in reducing the incidence of atrial fibrillation. Greg, what's your feelings about that topic?
I think it's a very interesting observation. We have increasingly thought about trying to aggressively treat patients early on in the disease. It's a progressive disease, we think. So treating patients with paroxysmal fib before they become chronic. And the use of antiarrhythmic drugs is effective, but has its limitations and adverse effects. So if there were other factors that might influence the course of atrial fibrillation, that would be important. And certainly the mechanisms, including inflammation, have become very important in understanding the causes of atrial fib. So if inflammation is a cause, and it appears that it may be, theoretically providing patients with statin therapy to reduce inflammation may benefit them. And the meta-analysis reported in this issue has shown overall a reduction in incidence of atrial fib if you use statins.
Right. Six articles in the meta-analysis, some 3,500 patients, showing an odds ratio of just under 0.40. So looking at this meta-analysis, pretty good evidence that statins actually do reduce the incidence of atrial fib. Now, I guess the question of whether or not you give a statin just for atrial fib remains up in the air, but they're proven to be valuable for so many things. Who knows, they may be in the water supply.
Yes, I think certainly in patients with an indication for them for vascular disease or coronary disease, you would want to treat them with the statins if they also have a high risk for atrial fibrillation. And indeed, the question will be whether we use that in our armamentarium to prophylactically prevent AFib in the future. I think there may be a real possibility that's the case.
Yeah. Now, one of the other topics that, of course, has remained controversial and for which there are very little, if any, data, are what to do with the patient who's got atrial fibrillation and on anticoagulants and needs a stent, where aspirin and clopidogrel would be involved. And we have a report on some 400 patients in this atrial fibrillation focus issue. That must be a problem you confront commonly.
Certainly. We're consulted regarding this not infrequently by our interventional colleagues. A patient with atrial fibrillation who may have risk factors for stroke, who's on anticoagulation, what do you do with that at the time of need for an intervention? With PCI, certainly acutely the warfarin could be held and you could use a short-acting anticoagulant, but chronically thereafter, all of the studies published in the past have clearly shown a benefit of warfarin over aspirin or even clopidogrel, and so we would be very reluctant not to treat patients. And I think this study showed that, in fact, and you maybe can give us these numbers, that there was a benefit for a triple therapy in these patients.
Sure. The worry, of course, was bleeding. If you have a patient now on Coumadin and on Plavix and on aspirin, what's the likelihood of bleeding? And in fact, there was a significant amount of bleeding overall, 12% bleeding in the overall study, but no statistically significant difference between the patients who are on triple therapy and the patients who were on aspirin Plavix alone. And of course, the major finding was that in terms of major events, mortality or MACE, major adverse cardiac events, that in fact the triple therapy had a benefit, those numbers being 18% versus 28% for mortality and 26% versus 39% for MACE. So sick patients with a lot of events, but triple therapy clearly producing the better results.
Yeah, I think that would certainly persuade us to continue Coumadin in these patients.
So that clearly your practice in the future would be triple therapy in patients who have atrial fib and stents as well.
Yes, I would follow that recommendation. Mm-hmm.
Perhaps one quick word about the paper on cryoablation. Is cryo playing a more important role in ablation of atrial fib?
I think it is, and we'll see much more of that in the future. Ablation of AFib has become a very significant approach to treating atrial fibrillation, and radiofrequency has some potential drawbacks, including risk of stroke, pulmonary vein stenosis, pain, and even maybe possibly rarely atrioesophageal fistula. And cryoablation may have an advantage in that it causes less of those adverse effects. And in this study, showed relatively good efficacy comparable to that with radiofrequency. So I think we'll see it used much more in the future.
So in the study in this issue, comparable results with cryoablation and perhaps some advantages.
Yes, indeed.
Well, atrial fibrillation is certainly going to continue to be a major problem for us, and hopefully the data that we have in this focus issue will help clinicians treat their patients in the best possible fashion.